All right, I guess we're live. Hi, everyone.
Hello.
Hello. Welcome back, everyone. For those people who are just joining us for the first time, welcome. For people who have have watched us twice before. What was episode number 3? Welcome back. I'm Dr. Teresa Sclafani. I'm a board certified interventional radiologist, and I am the owner and founder of IOR Interventional Vascular Care. This is Tiffany, aka
Noodles.
She is the world's best medical assistant and what's your other title?
Oh, patient
relations manager. She's just an all-around ray of sunshine, so everybody loves her. And she is becoming my right-hand person if she ever leaves me alone. Anyway, welcome. So today, we talk about all things minimally invasive medicine and beauty. So today we have 2 topics we're going to talk about. Do you want to introduce our topics, Noodle?
So we're going to talk about GAEs versus genicular artery embolization.
Yeah.
I got a pause right there. And then lipo, laser lipo to be specific.
Exactly. Laser liposuction with fat transfer. So, all right, let's get going. We'll talk about it. First, I was told that I look smarter with my glasses on.
Oh.
So I have to put them on. Because apparently I don't look smart without them. So. But remember, y'all, they're not real glasses. They're my lead glasses. Her glasses are real. My glasses are not real. They're my lead
naturally blind.
Yeah. So, what does it say? My battery is low. I was charging this thing the whole time. Uh-oh.
No, wait, you have battery on your laptop.
Yeah, it says it has battery there. Why does it say?
No charging detected. Charge less. Okay.
I don't know. All right, we'll keep going until we fail. All right. We're too big to fail. Anyway, all right, genicular artery embolization. So, what are the genicular arteries? Noodles.
They are in your groin.
In your groin?
Your knees.
I was not expecting that answer.
They're on the knees. It's like, oh, they go to the groin. It has to be on the groin.
That was good. I wasn't expecting that. You threw me further. No, the genicular. Yes, we go through the groin to get to that. So the genicular arteries are the arteries that feed blood to your knee. So what is a GAE? GAE is a genicular artery embolization, and it is a procedure that I do for knee osteoarthritis. It helps with pain associated with knee osteoarthritis. So, unfortunately, for many, many years, patients who suffer from knee pain with osteoarthritis and stiffness and that sort of thing, they're basically physical therapy, injections. So there's cortisone injections, which help with inflammation. And then there are commonly lay terms are called gel shots, which are hyaluronic acid injections or viscosupplementation, which hyaluronic acid is a natural substance in our body. I'm sure, people out there, you get hyaluronic acid for your skincare and that sort of thing. But so what that does is it kind of cushions the inside of the joint. So, cortisone for inflammation and then hyaluronic acid for cushioning and lubrication to help with the pain. But then after that, physical therapy and injections, it's like straight to knee replacement surgery. And there was really nothing in between. And a lot of patients, either they don't want knee replacement surgery or they can't have knee replacement surgery. So we, in the past 10 years, we developed this procedure called the genicular artery embolization, which is a little bit of a misnomer because the genicular arteries are, there's like 4 or 5 arteries that come off of the popliteal artery. So the popliteal artery is behind your knee, and then the genicular arteries come off at that level, and they feed your knee joint the blood. We're not actually embolizing the genicular arteries. So
you're just cutting the supplies, or what exactly?
So we're like trimming. Yeah.
Like a nail cut?
The groin artery is not good. No, I am totally, I don't know why, I'm totally blanking on, there's a specific term that we use when we talk about,
It's like a file, like when you have a file.
no, it's arborization. So I guess let me back up a little bit. So last week we talked about uterine fibroid embolization, right? So when I go in and I embolize the uterine fibroids, I'm going into the actual uterine arteries and I'm embolizing, there. So I am going into the genicular arteries, but the difference is when I do a fibroid embolization or if I'm doing an embolization, somewhere else, like if I'm doing a tumor embolization, I want to completely cut the blood supply off. If I'm doing a fibroid embolization, I want to completely cut the blood supply off. When I do a genicular artery embolization, I'm just kind of trimming the extra little capillary blood branches, right? So what happens is, and I guess I have to go back even further. What happens? How does genicular artery help with pain and why? Right? So I guess we have to go back there to understand it. Go back to the beginning.
All the way to the beginning?
Oh, no, wait.
Rewind.
I had, what's that song from The Sound of Music? Go back to the very beginning. You know what I'm talking about? No, I don't. I'm old shit. Does that mean I have to show you The Sound of Music? Have you never seen The Sound of Music?
I heard it. The Sound of Music is a movie.
Yeah, the movie.
Yeah, I saw that.
Yeah. You know the doe, a deer, a female deer? And then at the end they go back to the very beginning.
No,
okay.
I don't remember.
It was not my brain.
Joey!
Hello. Oh, hey! Hi, J&G. Welcome. I wonder if Nurse Bug is out there. We'll see. Maybe she'll say hello this time. I'm wearing my glasses for her. Anyway, so back to the beginning. What happens when you have knee osteoarthritis? So what happens is basically, the cartilage inside your knee gets worn away. And then the bones, they're kind of on top of each other and they rub and then that causes inflammation. And what happens is when you get inflammation to that knee joint, it creates angioneogenesis, which means that tiny little blood vessels, tiny little capillaries grow off of the genicular arteries and in response to the inflammation from the bones and the inflammation in the knee joint. And then it just becomes like a cycle. So you grow these tiny little capillaries. And then with all those tiny little new capillaries, you bring more inflammatory cells into the joint space. And then with more inflammatory cells, you get more tiny little capillaries. And then you get more inflammatory cells. And then you get more tiny little capillaries. And then you get more inflammatory cells. So you see,
I'm feeling my leg is going to look like an Oompa Loompa.
But it'll hurt. So that's what causes all the pain. So that's why cortisone shots, we'll do cortisone shots first because we're trying to stop or dampen the inflammation. But what happens is, the cortisone can only do so much.
And it's usually only a Band-Aid too, right?
Exactly. It's a Band-Aid. And also cortisone is not good for your joints. So after a certain number of cortisone shots, we kind of say, enough is enough because we're actually doing more damage than good. Yeah. So that's where the genicular artery embolization comes in because what I do is I go in and I trim off all those tiny little new capillaries that grew that you don't need, that aren't supposed to be there. And by doing that, it cuts the inflammation and then it cuts your pain. Yeah. So now, people who don't want to have knee replacement surgery, or people that can't have knee replacement surgery, or are just not ready for knee replacement surgery, but they're having pain, chronic pain, I can go in and I can cut that pain down. So up to 70% of patients who have knee osteoarthritis pain will get up to 70% relief from the pain after the genicular artery embolization, which is pretty cool.
That is pretty cool. Yeah. That's a good percentage, especially with arthritis, because it's hard to, you can't really cure arthritis.
No, you can't.
You have to understand that the 30% is because of the arthritis too. So
this does not cure osteoarthritis. Nothing cures osteoarthritis. The only cure for osteoarthritis is knee replacement surgery. And unfortunately, even after knee replacement surgery, up to 30% of people will still have pain, even after the knee replacement. Which, if you are one of those people, you can come to me and I can actually do the embolization on post-knee replacement patients. That'll help with their pain. So, and a lot of times I'll do a combination of the embolization because that helps the inflammation, and then I'll also do gel shots because that works different. It's a different mechanism. It lubricates and it cushions the joint. So together, it's a really, really nice combo. It's a very easy procedure. You come in, takes me about an hour to do. You recover for a little bit, couple hours afterwards. We make sure you're good. Get some nice sedation during the procedure, your nappies, you don't have to if you don't want to, but
I'd rather sleep.
Yeah.
Good night.
Then
I'll
that's
see
it.
you tomorrow.
Then that's it, and if you need both knees done, you come in 1 week, and then next week you come back, you do the second one, because we don't do both at the same time, because that would be too much, And
But how long is the recovery?
recovery is literally about a week, if even that much. The first 24 hours, I tell patients, take it easy, go home, relax. If you get sedation, you can't drive or drink alcohol, which is pretty standard. You may feel a little bit of a bump in discomfort right after the procedure because I am cutting, blood supply off to that little area. But then after that, it gradually gets better and better. And usually by about most patients will feel some relief in that first week. But then by about week 4 is when you feel like your maximum relief. So usually, if I'm only doing one knee on you, after a week, you come back, I check you out, everything's good. I say, you can do whatever you want. Just during that first week, no strenuous exercise, but you can do your normal activities. I want you to do your normal activities. So walk around, just don't start training for a marathon.
Do anything.
Start a I start a CrossFit, regime like right after the procedure. But, do your normal activity. And then after a week, if you're all cleared, you're clear to go. And then I'll see you at 4 weeks after the procedure and we assess and we see how you're doing. We'll take it from there. So, that's pretty much it. In order to do the embolization, and this is where the groin comes into it. So UFB, we talked about going through the wrist artery because this is your knee and it's further down and, we don't have catheters unless you're real short. Tiffany likes the Oompa Loompa. Yeah. If you're real short, we could go from the wrist, but if you're a taller person, we have to go from the groin because our catheters just won't. But it's okay. I use a closure device, and again, you hang out for about 2 hours after the procedure. We make sure you're good, and you go home. That's it. Same day. You come to our beautiful outpatient office. You get it done here. Noodles will take care of you.
I am the best.
She'll bring you snacks afterward.
And I will smile.
She'll smile. She'll bring you snacks. And then you go home. And that's it. So, let's see. What else? Basically, it's, turning down the volume of pain in your knee for your osteoarthritis. No hospital stay. No scalpels. No general anesthesia, which, if you don't have to have general anesthesia, that's a good thing. Some procedures you need general anesthesia, but this you do not. And that's it. And no joint replacement, which, look, if you want to get a joint replacement, go get a joint replacement.
Yeah.
This is not the same as a joint replacement. If you want a joint replacement, go. Yeah. I will encourage you. I'll say go. That's if that's what you want to do.
Yeah.
But there are people out there that they don't, or they can't. So this is
an alternative option.
Exactly. It's an alternative option. So, that's about it. Do you have any questions, Noodle?
No. I kind of got the idea, but you know what I'm excited to talk about?
What?
The Laser Lipo.
And some of that. And today's the last day of
the big flash sale.
Dun, dun, dun. Yeah. Okay, so I have hair that's attacking me.
I'm like staring like, wait.
I don't know what's going on. I don't know. Can you guys see it? Anyway. All right. Yes. Let's talk about laser. Oh, one more point I forgot to say. The GAE is covered by,
Oh, insurance. Hello.
it's covered by insurance. So, and we will take care of all that for you. So, unfortunately, laser lipo is not. But
Consider cosmetic.
it's considered cosmetic. But we, you know, as a reminder, we have financing options here at the office.
Nice.
So,
Or firm. I was going to say, but I don't know if I'm allowed to say it.
oh, yeah, sure, why not? Are we?
We're promoting a firm. Just in case.
A firm and Liquid Death. I forgot my Liquid Death. I want to be sponsored by Liquid Death. Do we have to like at Liquid Death or something? Is that what we do? What we do?
I don't know.
Like I said, kids, I'm learning. Sponsor me.
My name is Stephanie if there's any issues.
Where did that come from?
It's a different name.
Noodles. Noodles. We're looking for noodles. Well, no, we have financing options. So, because we do also minimally invasive aesthetic stuff here, you know. So yeah, laser liposuction. Okay, so what should we talk about? Laser liposuction. What is laser liposuction and how is it different from traditional liposuction? So, laser liposuction, it's kind of, I guess, self-explanatory. The cannula that we do the liposuction has a laser inside of it. And so the benefits of that is that we go in and we're able to heat up the area, you know, whichever area, let's say, pick an area. What are we doing lipo on?
Arms.
Okay, so we're doing arms. So I go in, well, first we anesthetize the whole area so that you don't feel anything, you know, you need a little something to relax you, make you comfy. Because again, all this is done in the office. So then I go in with the laser lipo, and basically the laser part of the cannula, it heats the area up. And so when it does that, it kind of melts the fat in the area so that when we do the actual suction, it's a lot more gentle. You know, old liposuction could be, I don't want to say, it could be a little rough, you know, like it's not, and then
Yeah.
so the fat comes out easier. So you're getting less bruising, less pain. Like, you know, we don't have to put you to sleep with general anesthesia. You know, I'll make you comfortable. We'll give you medicine to make you sleepy and relax you, but it's so gentle that we don't have to put you asleep. And then also one of the benefits, well, there's multiple benefits, but two of the big benefits are, one, the laser helps to tighten your skin. So, you know, when you do liposuction, you're removing volume from whatever area that you want to remove the volume from. And so when you do that, you know, you create space between your skin and where the volume was. So, you know, over time that tightens up, but the laser helps to tighten that skin up, you know, tighten it up. So it's a laser from the inside, which is awesome. You know, and then we can always, you know, the other things that we have in the office, I can throw a Morpheus 8 on top of that, and then you're going to be tight.
You can be.
I mean, because the laser from the Beauty Pill, which is the laser lipo suction machine, is the laser from the inside, and that tightens everything up. And then I hit you with the Morpheus from the outside with the RF microneedling, which, you know, patients who, like an older patient who has like crepier skin, I definitely would want to add the Morpheus 8 to it because that helps to improve the quality of the skin. So the laser from the Beauty Pill, the laser lipo, will tighten the skin from the inside, and then the Morpheus 8 will help the quality of the skin on the outside. So if you kind of have like a crepier skin or whatever, it'll help. It helps you grow back your own collagen. So it's a really nice combination. And you're already anesthetized from the laser lipo. So then I can just bring the Morpheus machine in and get it all done at the same time. And you're golden. The second benefit of the laser, well, the third benefit, because the first benefit is it helps to remove the fat better. Yeah. Second benefit is it helps to tighten the skin up from the inside. Third benefit is because the fat is removed in a more gentle manner, we're able to reuse it. You know what that means? Noodles.
Where are we putting it?
wherever you tell me, and I'll put it there.
Can you put it on the face?
As I go.
And why would you put it on the face?
So, well, there's people out there who pay a lot of money to put fillers in their face. Why put fillers when you can put your own fat?
I like that.
Yeah, exactly. So it's like a natural filler, but it's your fat, which means it's not going to dissolve. Fillers are great, but fillers, they dissolve. They all dissolve
It's
eventually.
chemicals, right?
Yeah, and it's something, it's a chemical outside your body. It's hyaluronic acid, to a certain degree, which, but it's a filler. So now we're just putting your own fat in, which is wonderful because it'll last as long as your own fat lasts, and we can fill your face. We can do your hands, we can put it in your breasts.
Ooh.
We can put it in your behind if you would like a bigger behind.
I know many people would.
Mm-hmm. The hips, there's a whole, you know what a hip dip is?
I got one.
Yeah, hip dip. I think everybody has a hip dip, right?
It's there.
People don't like their hip dip.
Oh, I
do like your hip dip.
I was very self-conscious about it for the longest time. And you know how I got over it? I went to Broadway, and the lady, she was beautiful. She had a hip dip. She was rocking the corset. And I was like, why the fuck?
Whoa, noodles.
Why am I?
We say foo here at IUR Interventional Vascular Care.
Please don't report me.
No, I don't think we're not. We're not on the radio. I think it's okay. But we don't have FCC regulations on TikTok Live, do we? I don't know. Somebody tell me if we do.
So my confidence came back. And I was like, I don't care.
See, you being a younger person and me being an older person, hip dip is like a normal part of the body's anatomy. Like, I don't, it never, like, I know nowadays people but I guess when I first heard about it, I didn't really understand that people are subconscious about it.
So. Well, it's because when you put on a dress, that's what bothers me because I'm going to say this wrong. I look like a caterpillar. No, I said it right.
Caterpillar?
Yeah, because you have the figure is you got this and then your waist and then you got the jump and then you got the.
I see what you're saying.
So I felt like I had
but you went nice and smooth, yeah. So
and that's what it was, and then I got over it.
Well, look, there are people out there who, if it bothers you, look. Yeah. My whole philosophy about aesthetics.
You have to walk it like you own it. So,
but look, I'm not here to make. Yeah. You look like a different person. I'm not trying to make you look like a different person. I don't want you to look like a different person. But if it's something that
feel comfortable in.
Right. If it gives you some confidence, I'm all about judging yourself. You want people to look at you and be like, oh, you look great. What'd you do? And you'd be like, oh, I had 8 hours of sleep. I drank 8 glasses of water. You judge yourself.
Spinach for breakfast.
Yeah, exactly. I had spinach and a B12 shot. If it gives you confidence and you feel better about yourself and you're doing it responsibly, then there's nothing wrong. That's my philosophy. There's nothing wrong.
Exactly.
But nobody's trying to. I don't want you to change into a different person, and you shouldn't want to change into a different person. But if your hip dips bother you, we can take care of it. Mm-hmm. You can take it from somewhere else and put it in your hips. Yeah, and I can do liposuction on abdomen, flanks, arms, thighs, the upper back. A lot of
people have that bra.
Yeah, they don't like
that.
The bra
that
strap.
Fat is very stubborn to take away, right?
That's basically impossible. Right. You can exercise and exercise. That's what, laser liposuction is excellent for, if you are a fit person, who works out and exercises and you just have that one area that is stubborn that you can't get rid of. This is perfect for that, Liposuction is not, and it never will be a weight loss supplement or a way for weight loss, because if you're trying to do it just to lose weight, we would create too much space between your skin and your body cavity that it would end up, your skin would look saggy and it wouldn't, that's not what it's for. It's not for weight loss. And plus, we are also regulated by how much fat we're allowed to take out, et cetera, so, but it's perfect for, you have a spot that you just can't, no matter what you do, because that's just our bodies, like,
Yeah, there's certain things you can't.
right. There's just certain things, that you
No one was born to be perfect.
exactly, but if it bothers you, we can take care of it. So that's, yeah. So laser, skin tightening, fat, we can use that as a natural filler for your face or anywhere else. Long lasting results, the results last as long as you take care of your body. I mean, if you go and gain weight, if you go and gain a lot of weight, but I mean, that's with anything. Yeah, it's going to come back. It may not necessarily come back as much in that area that we did the liposuction in, but if you gain weight, you gain weight. But, yeah, and that's it. And again, done in the office, outpatient procedure, in and out same day.
How long does it take to see the results?
You'll see the results immediately. So the day you walk out of here, you will see the results. But the results will get better and better over time. Because of course, afterwards, you're going to have some swelling, etc. But then, you wear compression garments because that helps to keep everything tight. Right. And helps to prevent any sort of, get rid of any fluid or anything, etc. You to heal well, basically.
Okay.
And then actually you continue to get, the skin continues to tighten and tighten and tighten for even months after the procedure. So 6 months later, people will say like, oh, I look even better because it just gets better and better. But you'll see the results of the volume loss like right away, right after the procedure. So that's pretty cool.
Yeah, that is cool.
Yeah. And so, yeah, I guess that's it. How long have we been doing this for? Oh, yeah, 26 minutes.
You press record.
Yes, I did.
Is it going to remind you? But I didn't know how to.
I did.
Okay, I didn't know where I can see it. I was like, how do I let her know this?
Press record.
Towards the end, right? But I don't know what was worse to tell you right in the middle.
No, I did. I did it earlier. And the reason why Noodle's asking if I press record is because one, we do the TikTok live every Wednesday at 6:30. So we decide on our topics beforehand. So if you have questions, please ask them in the chat and I will answer them, or you can DM me afterwards or contact me. The link in bio gives you all the contact information for the office, or DM me. I will answer your questions for you. If you come to the TikTok live, we're going to do that next. We're going to decide on our next topics. I can answer the questions for you. We also do a replay Thursdays at 6:30, and then you can also listen to us as a podcast. It's a Less is More podcast, and you can find us on Spotify and hopefully in time other areas, but I haven't figured that out yet. So
stay tuned.
Like I said, I'm learning. So yeah, I mean, that's it. So basically, if you are ready to walk with a little less pain in your knees, or you want to take care of an area, especially summer's coming, bathing suit season, which is scary for everybody, right? Is there anything worse than going and like trying a bathing suit on? No.
Very true. I think that happens to all of us, though.
Yeah.
And then you realize, oh, did I gain weight? Did I lose weight? Yeah. And then you find out you gain weight because there's no winter where you didn't lose weight. Like you always gain weight. I put on my shorts recently. I was like, well, this is tighter. I'm gonna say it's muscle.
I'm also in trouble because this one likes to bring me chocolate chip cookies. I'm like, enough.
And that's why my shorts are tighter.
All my shorts be tighter. But anyway, yeah. So, and we're having the flash sale. So the flash sale ends tonight at midnight. So again, you can find the link in the bio to the flash sale. If you are interested in the flash sale, you can also DM me. It's pretty cool. So the flash sale, we have two options. Option one is you can do one area of liposuction, for $38.99, which is the lowest price you will ever see. And then I also give you the option of adding on another area for majorly discounted price, and then fat transfer to the face, also majorly discounted. And then option two is you get an area of liposuction and a Morpheus 8 on top of that same area. And then again, you can also add an additional area and we can do fat transfer to the face. So all at crazy low prices.
Take advantage.
Yeah, take advantage. These are the lowest prices that you'll ever see. Was it? You don't know Crazy Eddie, do you?
No.
No. See, again, I'm old. All you people out there, J&G know who Crazy Eddie is. I don't think anybody else does. Prices are crazy. Anyway, so that ends tonight. So take advantage because there are only 10 spots available and 6 spots are already gone. Oh, and you also get a free firming skincare. So there's like only 4 spots left. So come on, guys.
It's almost done.
Yeah. And yeah, that's it. All right. So Noodles, what should we talk about next week?
I picked this one. I am running out of options over here.
What are you talking about? There are so many things we do here. There are so many procedures, running out of options. Okay, I'll pick. What should we talk about next week? Let's talk about let's see. Again, it's still Acne Awareness Month, the whole month of June. So don't forget, last week we talked about acne and the treatments that we can do for active acne and for acne scarring, which are the Opus and the Morpheus 8. And I'm still giving off, remember, you're giving my TikTok 10%. You show up or you DM me and 10% off of all Opus and Morpheus 8 packages. Get inundated with a lot of false information about skincare. So I think that's important. We'll talk about that. And then what medical topic should we talk about? Should we talk about varicose veins?
Let's talk about varicose veins.
Let's talk about, we'll do skincare. What's the difference between organic, over-the-counter, and medical grade skincare? And we'll talk about varicose veins and the different treatments that we can do for varicose veins and spider veins. How does that sound?
That sounds good. I like that.
All right. Well, I guess that's it, cats and kittens.
It's over.
So thanks everyone for joining us. Again, I'm Dr. Sclafani and this is Noodle. If you want to talk to either of us, DM me and I'll pass your message along to Noodle if you want to talk to Noodle. Or you can call the office. You can call the office or you can text the office.
516-240-1547.
Exactly. And then again, link in bio gives you all the information. But again, I'm always happy to answer anybody's questions. So if you have any questions about anything we've talked about this episode or episode before, last week we talked about uterine fibroid embolization and we talked about treatments for acne. And in the first episode we talked about dementia has set in. What did we talk about in the first episode?
We had this situation yesterday too.
I know. Oh my goodness. What did we talk about in the first episode?
We talked about sunblock.
Oh yeah, it was SPF. It was National SPF Day. So we talked about SPF.
Yeah, that's what we talked about. I remember.
I'm in a sugar coma because she gave me a chocolate chip cookie that was like this big. Actually, no, I'm so
Okay.
I bought her a chocolate chip. Anyway, yeah, so that's it. Thank you everyone for joining.
Thank you.
We'll see you again next week. Come ready with your questions or DM me and we'll talk. All right. Bye.
I got a toodles.
All right. From IUR Interventional Vascular Care.
I got a oodles or toodles or whatever you want to call it today.
Noodles. Noodles got a toodles. No. Hi, guys.
Hi.